Visceral fat. It's not just about carrying a few extra pounds around your middle. This fat inside the belly, wrapped around your organs, is biologically active. It doesn't just sit there. It produces chemical messengers that drive inflammation. And when it comes to Crohn's disease and colitis, this type of fat becomes very important. Research shows that people with Crohn's often have more visceral fat than people without it. In fact, doctors have a name for it: creeping fat. That's when the fat literally wraps itself around the inflamed parts of the intestine. It doesn't appear to happen as much in ulcerative colitis than in Crohn's. So why does this matter? It's because visceral fat is not just a bystander. It acts as an immune organ. It pumps out inflammatory chemicals like TNF-alpha and interleukin-6, the very same molecules targeted by drugs such as infliximab. So the fat itself becomes part of the disease process. Studies show that the more visceral fat you have, the more likely you are to have complex Crohn's, things like strictures, fistulas, or needing surgery. And even after surgery, people with more visceral fat are twice as likely to have their disease come back. Now here's the twist. Your overall weight or body mass index isn't always the issue. Two people can have the same body weight, but one might have a lot more fat tucked inside the abdomen. That hidden fat is what drives inflammation. Some research even shows that people with lower visceral fat respond better to biologic therapies. So what's the big picture? Visceral fat is not just storage tissue. It's an active, immune-sparking tissue that can literally change the course of inflammatory bowel disease. That means if we want to tackle Crohn's and colitis at the root, we can't only think about inflammation in the gut wall. We also need to think about the environment around the gut, and that includes the fat wrapped around it. And here's the empowering part. Visceral fat can be reduced. When you get your diet right, and when you live in a light environment that supports your biology instead of breaking it, you change your metabolism. You lower inflammation at its source, and you give your gut the chance to finally start healing.